This is Kuldeep Chaudhary for Health in India. The field of cardiology in India has been developing at a very rapid pace in the last couple of decades. In the year 1988, when Dr. Niraj returned from the United States and set up the Escorts Heart Institute, that was probably the beginning of advanced cardiac treatment in India. In the last 2 decades, a large number of cath labs have come over the country with a large number of cardiologists treating the patients with coronary artery disease. With the advancement of the cardiac facilities have come the negative issues wherein the patients now doubt whether the cardiologists are treating the blocked arteries. When a patient with a myocardial infarction is taken into a cath lab and suddenly the cardiologist announces that 2 arteries are blocked and the patient would need stent, there is a doubt which is creeping in the minds of the patients. In such a scenario, there are very few cardiologists who have the trust of the patients. I am accompanied by one of the most renowned cardiologists, a cardiologist who is renowned for his honesty towards the patients and absolute care for their hearts. Dr. Niraj Kumar, who is a senior cardiologist at Artemis Health Institute, is with me in the studio, and let us begin by asking him, why do the patients mistrust the cardiologist these days? Hello Dr. Niraj, and welcome to the studio of Health in India.
Hello Kumar, thank you.
May I ask you, today many cath labs are present. 5 years back, Gurgaon didn't have even a single cath lab. Today you see there are at least 6 to 7 cath labs doing almost 600 to 700 interventional cardiac procedures. What are the major factors for the patient not trusting the cardiologist?
See, with the kind of proliferation in interventional cardiology, the patient thinks that if he has come to a hospital, the first someone will examine, discuss the things with him, will appraise him about the criticality of the situation, will discuss with what are the options available. But there is I won't say the trend, it may be the need of the hour, that when a patient comes with a chest pain and if it's an acute heart attack, then the doctors also hardly have time to discuss it in detail, because the time is the muscle at that time. And a patient having a heart attack, the earlier you open the artery, the better is the chance of saving the life of the patient. But the patient has a doubt. If a person comes with a chest pain and immediately the doctor says that he needs an angiogram and probably an angioplasty also, and he has to deposit a huge amount that he is mentally not prepared for. So I won't say that the doubt is right or wrong, but probably that's the human nature. And there, the tactfulness and the clarity, the transparency, and a feeling about the patient, that the patient may be your family member, and you have to step in his shoes to understand his thought process at that time, that helps.
Okay, we've been hearing that time is life in lots of matters now, whether it is a stroke or it's a head injury or it's a heart attack. So everywhere the doctors say time is very crucial. So what should a patient who has got a suspected heart attack, what is the ideal line of treatment? Because all the doctors or the hospitals with cath labs, they'll try to pull the patient to themselves. So from a cardiologist, I want to know, what is the ideal line of treatment? Where should the patient go with, say, symptoms like chest pain?
See, the chest pain per se, if it is associated with sweating, or the pain is radiating to the left arm or to both the shoulders, sometimes radiates to the jaw, patient not feeling really well or having suffocating feeling, the chances of having a heart attack or an angina is high. But there are other reasons also that can cause a suspicion about, that can cause chest pain, and the patient, of course, many a times when they give us a ring, even a leading question doesn't clarify these issues. Sometimes a simple acidity, sometimes an hiatus hernia, sometimes just a muscular pain and anxiety may cause the similar symptoms. So, but Of course, rest everything put apart, on heart attack is the most risky thing to the life, and that risk is maybe in minutes to hours. Even if it's not a danger to the life, but it may be a danger to the quality of life, because the heart gets damaged very fast if an artery is totally occluded. That is, in layman language, we say as a heart attack, complete heart attack. So I will say that the patient and overall the people should be aware about what is chest pain and what are the associated symptoms when it can be a heart attack. They should be aware about what treatment they can take at home, like just crushing a tablet of Disprin inside mouth and allow you to dissolve sublingually. It helps. Or then I think the first thing which should be done is an ECG, preferably at a tertiary care center, because if it shows an acute heart attack, it can be helped immediately. Or for any nearby physician or hospital where an ECG can be done and somebody is able to read that ECG and say that your ECG is normal or not. Although, even with a normal ECG, 5% people can have heart attack. But that is means chances become very, very less.
Okay, so you're saying the patient should at least go to a hospital which has a physician and a facility of an ECG. So let's say the ECG shows that there is a heart attack. So what would be the line of treatment taken by the physician then? Because he doesn't have the facility of interventional procedure like an angiography and all. So what's normally the line of treatment taken by that physician?
Now, a physician can, if he has a suspicion, so we can here a physician can at least divide the patient in three groups. One, if there are ECG changes or of a full-blown heart attack, then he should give some blood thinners orally as well as some IV or subcutaneous medicines as blood thinners. He should try to see about the hemodynamics, like how are the pulse and BP, and he should try and arrange shifting the patient to a tertiary care hospital as soon as possible for an immediate angiogram and angioplasty. In the meantime, he should inform the patient family also, so that they can arrange for the requisite money and help. If possible, he should communicate with that tertiary care center also, so that they are also prepared with their team and no time is or minimum time is lost in the process. If there is no place immediately available for shifting the patient, and within few minutes or 2 hours, 30 minutes to half an hour, that the patient can be shifted to a tertiary care center, he can probably give some blood thinners that is termed as thrombolysis to try and bust the clot and open the artery. Although that is successful in 60 to 70% cases only, but that he can try. The second group is where there are ECG changes, but they are less than full-blown acute heart attack. That is mostly termed as acute coronary insufficiency or unstable HF. Then he can give the treatment, and again, it's not that kind of an acute emergency, but the patient should again refer to a cardiologist at a tertiary care center so that he can evaluate and do the needful further. The third group is where the ECG is normal. Then the patient can still be advised about the possibility, the small possibility that remains about the cardiac thing, but then he can give the preliminary treatment. The patient can see the doctor the next day.
Okay, so we've known that how a patient would be handled at a secondary care facility, and we'll come over to the fact that how a tertiary care center would manage a patient. In the